Okay, there are different surgeries for weight loss. Laparoscopic adjustable gastric banding. This looks like a viable option. Okay. This is going in and just putting a band around the stomach. Laparoscopic sleeve gastrectomy is going in, putting a vertical banded gastroplasty. So you're making the stomach smaller and having the band. Then there's a Roux-en-Y gastric bypass, and this is taking a piece of the small intestine and connecting it to the stomach, and it's really diverting it away from the stomach. It's connecting it high up in the stomach, and the stomach is really, you make a little pouch out of the stomach. It's a tiny pouch with 20 to 30 milliliter capacity, not much. And then you divert using the roux limb, divert the chyme contents down to the lower part in the small intestine. Now, with this Roux-en-Y, it can be dangerous, but it is very effective. In terms of clinically significant weight loss. 6-year study done with 418 patients, 92.6% follow-up data. After the follow-up, patients lost 27.7% of initial body weight. 2 years, 96% maintained at least 20% of their initial body weight. So 96%, that's really good. At least 20% of their initial body weight. Initial body weight. I guess they're talking about 20% weight loss of the initial body weight. I think that's what they're saying. But I don't trust statistics. Okay, 6 years, 74% maintain at least 20% of initial body weight. Diabetes remission occurred in 62% of patients. That's awesome. There's a graph, a very important graph about obesity. It has been increasing. It's on the rise. Especially in kids that are, what is the age? 6 to 11 years. For kids 2 to 5, it's going down, which is good. But we'll see. It's still a struggle for every age group there. Preferred weight gain in childhood. Birth weight doubles by 6 months. Birth weight doubles, should double by 6 months. It should triple by the first year. I'm talking about kilocalories. For a 1-year-old, it should be 1,100 kilocalories. 2-year-old, 1,200 kilocalories. Okay, and this has to do with the birth weight. And right away we give 1,000 kilocalories. So after year 2, after having just tripled, probably, let's see, so you tripled by year 1, so it should be around 27 pounds. Okay, 27 pounds. And for year 2, you're supposed to add 3.5 to 4.5 kilograms. 3.5 times 2 is about 7. So you're adding about 7 pounds to the 29 pounds. So you're increasing body mass, but not as much as you did throughout the first year. So you're just adding on 1,000 calories per year to feed these kids. Okay, year 3 plus, keep adding 2 to 3 kilograms until 9 to 10 years. Okay, and then there's increases of body weight before puberty. Okay, pediatric measures of adiposity. Puberty, we get growth spurts, right? And from the age of 5.5 to around 7, there is an increase of adiposity. Now, that doesn't mean it's bad. That means it's normal. Okay, it's normal to have an adiposity rebound from 5.5 to 7 years old. Okay, 7, 9, or 10. So kids should be gaining weight there, but it's problematic if they're gaining weight too much around 3 or 4 or 5, because that means they're having an early adiposity rebound. Okay. Okay, what is structural weight management? Okay. Well, first let's talk about pediatric measures of adiposity. So, overweight is anybody that's 85 to 95, 85 to the 95th percentile. Okay, a z-score of 1.04. Obesity is anyone at 95 to 99 percentile. And this is meaning, starting weight and what percentile they go to become in terms of their height. And weight. Severely high adiposity is greater than 99 percentile. Okay, in each percentile we see there's a rebound. Okay. However, in the higher percentiles you see there's an earlier rebound. That's problematic. Okay, looks like the rebound should be around 5.5. Okay, a little later in those with lower birth weight. Okay. Shape of BMI. So it definitely has an effect when you have an early adiposity rebound. Your shape of the growth curve will be changed from to more risk for obesity. In the future. Okay. So how do we treat obesity? How do we change the way we interact with each other about obesity? What's the best way to do it? Okay, parents' attitudes toward their own weight is important. They should not be overly critical. Parental concern about the child's weight should not be overly concerned. Okay. My parents had food around all the time. They didn't care about my weight, and Thank God nothing bad happened. There has to be some sort of control, but there shouldn't be autonomy. So autonomy meaning just what you say is, you know, is the law of the land, and there should be some sort of democracy there, some give and take, some compromise. It should not be a complete restriction of highly palatable foods associated. Well, actually, there should be a restriction of the highly palatable foods associated with overweight, but it shouldn't be too restrictive. Family behavior. Kids will definitely consume foods away from home. Okay. Especially the adolescents. But that's a risk factor. Increased portion sizes, breakfast skipping, screen time, inactivity. But the family has protective aspects to it. If you have good family cohesion, that's a protection against obesity. If everybody's feeling free to express themselves, that's a very good protective aspect. A democratic style of running the family, protective aspect. Parental support, protective aspect of the family. And cognitive stimulation. So when you have stimulation of the mind, that's a very good protective aspect, and that's going to guard against overeating and obesity, and it's going to enhance your quality of life when you're stimulating the mind. Okay. Expert committee treatment. For those age 2 to 19 with a BMI greater than 85%, there is a stage 1 prevention plus protocol. They say give less than 2 hours screen time and make them play outside 1 hour. Okay? At least 1 hour a day. Stage 2, if that doesn't work, you can give less than 1 hour screen time. Very strict. 1 hour should be supervised play. Make sure they're playing. And give them a meal plan. I love how play is a treatment. I love it. Play is recreation, but it's an essential part of life. People need to realize that. They want their kids to be healthy, And okay, so these kids have to have 1 hour supervised play, meal plan, weight loss not greater than 1 pound per month for age 2 to 11. That's when you start that. Okay, and checking how much weight they lost. If they didn't lose a pound per month for these kids age 2 to 11, then that's a problem, and that's when you start the stage 2. Okay, stage 3, if that doesn't work, then you start a comprehensive multidisciplinary protocol. Stage 4, if that doesn't work, use tertiary care, so meaning treating the disease. Okay. Structured management. So once again, that's instituted when you don't have the 1 pound of weight loss for these kids 2 to 11 years old. And that's that.